right, good morning, everyone. Thank you for joining us for the Colorado Respite Coalition Biannual Statewide meeting today. My name is Megan Kluth. I'm the Director of Respite Initiatives here at Easter Seals, Colorado, where we manage the Colorado Respite Coalition. And we have a few people here in our main office in the Denver area, and then quite a few people on the phone. So again, thanks for joining us. We're going to kind of just dive right in because I imagine there will probably be a lot of questions. So I'm going to go ahead and share my screen. Feel free, if you're having any issues with seeing or hearing anything, to just put a little chat box in and we'll have somebody monitoring it, just making sure everything looks good. This is also going to be recorded, so if you have to step away or miss something or want to share it with your colleagues, we will be posting it on our website probably later today. So don't worry if you aren't quite sure if you missed a little bit or not. And we will have quite a bit of time for questions as well, so certainly let us know if something comes up. So that being said, so just for anybody who's kind of new to us, or this might be your first time at a Respite Coalition meeting, essentially we're a group that's housed at Easter Seals, Colorado. The Respite Coalition is one of our programs here. We are a statewide program, and we support the full lifespan and disability health spectrum. So we serve a pretty broad variety of families and professionals. And essentially, we kind of work together to try to increase access for families to be able to get to respite care and support professionals that are serving those families. So today we're kind of going to focus on our grant application, which I imagine is probably the most of interest item. But we'll also give you some updates on some of the other initiatives we're working on, and certainly have some time to have questions about all of those pieces. So if you haven't already found it, we released a new respite grant RFP on Monday. It may be helpful if you are able to just bring it, have a copy next to you, or bring it up on your screen while we're chatting. But we will kind of go through the basics, and then I really just want to open it up for questions. I know some of you have applied in the past, and for some of you this is a new thing. So certainly, we definitely encourage questions as much as possible. So kind of the basics of the application. Again, it was released on Monday. Applications are going to be due by 5 p.m. on August 22nd, so about a 3-week period for you. We are opening up an online submission option, hoping that it makes it just a little bit easier for everybody. You certainly can still mail in or drop off in person the applications, but on the RFP there's a link, so you can just kind of click on it and see what the new submission online looks like. As somebody who's written a lot of grants myself, it feels a little bit easier to do it that way than to be trying to piece together documents by email and hoping somebody got the email. So hopefully that goes smoothly. Please, I mean, this is a new thing for us, so if you have any issues at all with it, please let us know, and we will be as quick as possible to address those. And I definitely recommend, if you can, hop on that before August 21st or August 22nd, just in case you have an issue. I've been there too, I understand. And essentially, we'll kind of get into a little bit more of the details, but basically this is an application that's available for agencies that have some sort of existing respite program. So it can be kind of expanding or enhancing a program, but it is not available for startup agencies or brand new programs that haven't been providing services. And we have a pretty broad definition of respite, so it could be in-home care, day program, center-based program, or recreational. Certainly I'm happy to take questions today or chat with you guys offline if you're kind of not sure if your program might qualify. And I think we kind of pride ourselves on having a pretty broad view of what respite can look like for families. And the main thing for us is as long as the family caregiver has the opportunity to walk away and get a little bit of a break, generally it fits within our definition, but we can certainly chat through details. If you're kind of sitting there wondering, I don't know if my program qualifies, just let us know, and I'll have my contact information at the end. I would much rather people ask the question up front before spending too much time diving in if they're not sure if it's a good fit for them. We do, based on the last couple years, anticipate a really competitive grant process. Last year, we actually had more than double in grant requests for the money that we had. It was the most competitive cycle we've had to date. I anticipate that it may grow even more this year. For those that have known us for a while, we have in the past offered 2 grant cycles. We've kind of switched because of the demand to one longer grant cycle. So barring something unexpected, that will be the case again this year. So it'll be like a September through May timeframe to be able to share services or connect with families. So hopefully that gives people kind of a comfortable timeframe to do that. So basic eligibility. Again, this is going to be for existing respite programs. And all of our funding, the funding for this grant program that comes from state general funds, and so to be good stewards of those dollars, we do require that the families being served through this grant process, that it's a payer of last resort program. So it could be families that are either underserved or completely not served by more formal funding for respite. So maybe families that are currently private paying or that you're scholarshiping would probably be good options. We don't necessarily require like an income-based approval process, so certainly some agencies choose to do that, which is fine. But we do kind of ask that you let us know how you're going to be determining who is being served. And then I will make one note on this, and we'll go a little bit more into what this program is if you're not familiar a little bit. But we have had grant awardees in the past that also serve as partners on our respite voucher program, and you can certainly be on both programs. You just can't be serving families at exactly the same time. So if you're in that boat and you have questions about that, we can certainly address those later or offline, but don't think that like you can't participate in both programs, because it certainly has been done. Again, these funds are available to support our families across the lifespan and disability and health spectrums. We really want to spread the funds as much as we can across these populations, and that's definitely something
I'm on a webinar.
When we're reviewing the process and the application. And same for statewide.
I don't know if hey, Jan, we've tested it, and Laura's going to let you guys know if you forward the phone, it doesn't go to your personal voicemail, it goes to the main.
If you don't mind muting your phone, that would be great.
I can do that if you want me to.
Thank you. We just had a little bit of background noise there. So this is a statewide program. Much like being conscious of spreading it across the lifespan, we try to make sure that the dollars are spread throughout the state. So certainly, if you're serving rural areas, please make note of that in your application. But just know that this is available across the state. The services do need to be provided in the state of Colorado, though. We have had instances in the past where people have been looking at potentially providing services if they're on the border. They do need to be for Colorado residents and provided within the state. And then an agency, if they're applying, must be willing to complete fingerprint-based background checks. There's a little bit more information in that requirement on the RFP, so if you're kind of unfamiliar with that process, I would definitely take a look at that page. But it's part of the statute that funds this grant process, so it's something that really is absolutely mandatory, and if you have questions, we can certainly talk through that. And then lastly, probably what you want to know more than anything else, kind of the anticipated award range is usually between $5,000 and $35,000. That's a fairly large range, but I always tell people, I mean, given the high demand, there's a fairly good likelihood that we won't be able to beat 100% of people's award requests, but I would definitely suggest apply for what's realistic and that you know you can spend and spend well, but don't necessarily limit yourself. So just be as detailed as you can and realistic in your application, and we can go from there. So I would like to just sort of open it up for questions on that, and we will, if people send them by chat, we'll share them with the group and just make sure that everybody's questions are heard. If it's super specific to your program, I would definitely recommend reaching out to me after the call and we can chat about that, but if it's kind of like a general question, certainly speak up. And we will be posting, the webinar that's being recorded online, so we probably won't post specific questions unless we feel like they're extremely common ones from this meeting. But if people do submit questions after today, we will be posting them on our website, just so if somebody else has the same question, check there first. So the question, that's a great question. What type of activities have we funded? I would say about as broad of a variety as you can imagine. So we have served, so this is our 6th year, I believe, doing the grant program. We've served a lot of in-home, a lot of day programs for all ages. We've done a few more recreational type programs, sort of like more of a camp setting. We've done more where people go out in the community. You know, we've funded very disease or disability specific programming. We've funded more that's sort of like open-ended for any age. Does that help answer your question? Okay.
So workshops, paying for staff.
Oh, gotcha. Yep. Good question. Yep. So we do have a maximum administrative cost, which is 12%. In terms of like direct program cost, which would certainly include staff time, you know, direct program supplies and expenses and things like that. Like that wouldn't qualify towards administration, but we certainly understand. Like you can include the cost of the background check as part of that administration fee part. Yeah, I mean, it's certainly, if you're kind of not sure if something fits, just reach out to me and let me know beforehand, and we can definitely talk through it. I mean, it needs to be things that are really specific to the grant. We have had people in the past that have put things that, like, the agency would have to do no matter what, regardless of our grant. Like, full agency insurance would be an example where, like, an agency would have to do that besides, yeah.
So, in our case, try not to be too specific.
That's okay.
Try to narrow it down. So, we provide that care with them. What I'm noticing from doing this here, and we have over 100 of them, is that there's somewhat a gap for parents around self-care as well as around problem solving.
Sure.
From a more coaching point.
Sure.
Parenting from a, you know, so parenting coaching from a, you know, not just related specifically to the DBG.
Sure.
And 23 and he thinks he's going to go get married. How do I have this conversation?
Sure.
What I call family conversation.
Sure.
Who used to call family. Yeah, I think it now just family structure. So would that kind of parenting support fall under that category of respite? Because it's not necessarily respite.
That's a great question. So if you weren't able to, sure. So if you weren't able to hear, this is a really good question. So the question was kind of like, could you provide education to families and training and types of things? For us, as long as yes is the short answer. The kind of longer answer is, so we do have instances where some programs provide like a support group, but there is still being respite and care provided for the person's loved one, but the caregiver has the option to attend a support group, or same thing with like a training session.
Right.
As long as they have
So if Medicaid is paying for that respite service, right? We have a respite provider that's Medicaid funded, but then you have the option for that mom to be at the workshop. So I'm not counting this because Medicaid is funding that.
Right.
But can I find mom and dad coming over here for 24 hours to just chill?
Yeah, I think that's a great question. Sure.
You know,
so the question is, if you have another funding source providing the actual respite service, can you use these grant funds for support the family caregivers? For this grant, I would say no, but I have a caveat to that. The statute that gives us this funding for the state general funds directly requires it be direct service. So in that regard, it does need to be specific. But if you did that and provided the respite through this, that would be fine. But we couldn't have one payer doing them. But I will say we do also have some different funds that we can talk a little bit about for training specifically and workshops. So you could potentially talk to us about applying for some funding if you wanted to do specifically education. But you could certainly do what you're describing if you utilize the funds to cover the respite, or at least some of it.
Okay, so if I did, let me give you another scenario. So say I got a deal with YMCA. So I get to bring the whole family up. I pay respite providers to watch the kiddos while I have mom and dad maybe in another workshop across in different cabins. Is that it? Then I'm taking respite dollars out of the grant as well as the family. But if you're the payer of last resort, then where is Medicaid?
They shouldn't.
So these are for families who are not Medicaid.
Well, I mean, sure, no, absolutely. No, I think these are really good questions, and I'll just repeat for anybody who couldn't hear on the phone. So in terms of the last resort, if they're pretty severely underserved by the Medicaid waiver, that's definitely an option. No, I mean, yeah, I mean, the majority of families we serve don't get any sort of formal funding. Some do, but it's really minimal, or they're on a wait list or things like that. I understand what you're saying.
Yeah.
It's not that it can't be done, it just needs to be done in a way that, like, we can really understand how they're underserved or not being served. So, like, for example, we've had families in the past where they qualified for, like, a one-day-of-a-day program, and that was the only option available, and that was just, like, the family was in a crisis because of that. We could look at expanding that so that, Medicaid could pay 1 day of their respite a week, and the grant could cover the other 2 days. They just can't be double dipping.
Yeah, just for some context, I do grant writing and program development and stuff like that. So I understand, can't do this. That's what I'm trying to distinguish out what activities you can do. Because all of the clients that I have are dealing with the pathological topics.
Yep.
So there are, which is where some of the coaching stuff comes in.
Right.
Because they have stuff that's outside of quote unquote Medicaid.
Right. No, I absolutely understand.
But if you don't make sure that they're staying indoors,
Yep. No, I totally understand. Well, I know we've got a couple other questions, so let's keep chatting, and I can give you my card, and we can definitely talk through it, but there's a couple in the chat box. No, that's okay. These are all good questions. This is exactly why we're here, and I certainly... Hang on, we're having a little technical difficulty. Bear with us. Okay. Perfect. There's a question in our chat box. Is there... sorry. If people could just mute their phones if they're not talking, that would be great. It sounds like people are having some feedback noise issues. There is a question, though. Is there a possibility that applications are funded for amounts other than requested instead of denied? Yes, great question. This has happened before. So, for example, you might apply for $25,000, and due to constraints in our funding and really trying to kind of spread it out as much as possible, you might be funded for $19,000. if that's the case, we'll certainly work with you to adjust. We're not going to just like say, here you go, great, but we'll certainly work with you to make sure it's all doable and everything. But yes, so that's what I would say. Apply for what's realistic. I mean, definitely don't limit yourself, but also kind of just make sure that you really, it feels like an amount that you can serve. And we, in the RFP, it talks about, so again, we are state funded, so we try to stay as close to Medicaid reimbursement rates as possible. So our reimbursement maximum for our respite is $20. So the way that we kind of figure out how many hours there should be is essentially, I would recommend dividing your grant request by that $20. And that'll kind of give you a sense of like, is that a realistic number of hours for you to be providing? Because that'll be kind of what we'd look at. I will say I don't vote on the grant, so I'm happy to have conversations with you guys beforehand, because I can do that in an unbiased way since I'm not voting. But yeah, I definitely, it's much easier and much more efficient for everyone's time to be asking questions beforehand, and I just want to make sure this is a good fit for everybody. So if you're kind of not sure about those things, or if you're really not sure, is my program a good fit? Does this seem like a reasonable request? Feel free to just reach out, and we can definitely chat. So, are there any other questions on the grants specifically? I know I'm seeing a few people hopping back on the call, so we'll give everybody a few minutes on the chat box. Do you guys have questions? Okay. That was just a program-specific question. So. One thing we haven't talked about is we have had in the past, sometimes agencies will kind of collaborate with other agencies. That's definitely an option. So again, if you're kind of not sure what that looks like and you might have an idea, I've already had a couple people reach out to me about that. We can certainly get on the phone and chat, especially if you might be in a rural area or you're trying to kind of serve a population that might be a little bit more tricky. That can always be a good possibility. We've definitely seen people get really creative with this process. Okay, so somebody had a question, and I think this is a good question probably for most people. It's if an organization receives funds from the State Unit on Aging, would this disqualify the organization for the grant? So essentially, I think the question kind of applies to everyone, because if you're receiving other state funds or using Medicaid funds or anything like that, no, it does not disqualify you. As long as you're keeping them separate, that's fine. It's essentially, you just can't be double dipping. So very similar to some of the Medicaid questions before. As long as there's not like actively using both for the same family at the same time, but we've certainly seen instances where, you know, so a family maybe is getting supported through other state or federal funding, and then during the grant period they're not, you're using our funding, or you know, they get a very minimal amount. Yeah, exactly. Somebody in the room just said use it to fill in the gaps. That's a really good summary. Yep, if somebody's on a wait list or they've maxed out their funding or other things like that, this is, yeah, I think this program really is designed to fill those gaps and catch those families that, you know, may not be getting respite at all because of a lack of funding, or are pretty severely underserved or not being served at all. But no, I mean, those are great questions, though, if you're worried about other funding. But essentially, as long as there's just not active double dipping going on, usually we can be pretty flexible. I do recommend, though, just put that in your application if you're kind of not sure if you're like, oh, we're using other funding. Definitely better to be kind of transparent, and we can ask any questions of concern while you send the application in. Good question. Anybody else? Okay, well, it looks like it's pretty quiet for now. We're going to go ahead and move on to the rest of our meeting, but we should have quite a bit of time left at the end for questions. So if you think of things, feel free to put them in the chat box or just chime in, and we will make sure we get to them before the end. And again, if you think of something as soon as we hang up today, my contact information is going to be on the end. You can certainly submit questions up to a week before the deadline, and we will get an answer to you. So I am going to turn it over now to Ellie Billman from our staff.
Great. So I hope that y'all are really excited about those opportunities. Another opportunity that we have for partnership, at least with agencies, to help support family caregivers access respite is through our Family Respite Voucher Program. This program provides financial assistance to family caregivers with limited access to respite. So again, those that are really falling in between the gaps of Medicaid services or being on wait lists or trying to private pay. With this program, we partner with agencies who become approved providers and contract with us to accept our funding. So that way we're able to make payments directly to agencies, provide the respite to the families, so there's no out-of-pocket fees for the family caregivers. We are getting close to wrapping up our current cycle of funding here on August 18th, and then we will have new funding that begins here in September. So if any of y'all want to talk more about what it looks like to become an approved provider, what our agencies look like, I'd be happy to talk with you more directly on those pieces. And I did want to share some highlights from this cycle of the voucher program and, kind of talk about the impact there. So in this last year, starting September 1, 2017, and again running through August 18th this year, up to this point, we have served 199 family caregivers and 215 of their loved ones, because oftentimes we see that family caregivers are caring for more than one person, whether that's multiple children, both parents, or being kind of in that sandwich care for a child and a parent as well. Over 5,500 hours of respite have been provided through these respite vouchers, and that stretched across 22 counties within the state through our 34 provider agencies that we partner with. This is a statewide program that serves all ages and all special health care needs. It's a quick little 2-page application that's available for download on our website. And the voucher awards are typically $500 to $1,000 for a family to use within a 4-month period or until the conclusion of the program. Again, it's a really great way to be able to support and supplement the families that you're serving that are struggling to private pay or that you may be scholarshiping, and a really good opportunity to truly gain some new clients as families are awarded vouchers and then are able to select the provider agency on it. So that's really what I have here for the voucher update. Again, if you all have questions, you can contact Megan or myself, and I'd be happy to walk through what the program looks like and what it feels like to be a partner within that.
Yeah, and again, you are able to participate in both of these programs at the same time. So this is a great opportunity too. I think there's clearly a lot of overlap between the programs and similar services. So definitely recommend checking both of them out. Did just have another question through. Good question. So we had a question back again about the grants. Do we expect to make the same number of grants as in the past? Where can I see who was awarded funding last year and what types of programs at what amount? Good question. So we had, I believe, the 2017. We're going to explain. We're doing some website updates, so it's possible something got lost in the shuffle. What we can do is make sure that we have the 2017 and 2016 awardees listed. We do not typically list amounts or types of programs, but I can certainly kind of speak to that. So in terms of number of awards, we don't have a set number that we make. It's really based on what comes in. I will say we try, or I should say the review committee tries as much as possible to spread it out and reach as many counties and populations as possible. So it's not super heavy on older adults or kids or the front range or anything like that. So that's definitely a consideration. But there's not a kind of a hard set amount of grants. My anticipation is that it's going to be pretty competitive. I certainly would encourage as many groups as possible to apply. Kind of good news is that each year we do this, we're seeing new populations and new agencies that we haven't seen before, so that's pretty exciting. But really, I'm not exaggerating when the range of awards has been $1,000 to about $35,000. So there's not average per se. But I mean, in terms of funding available, we do have about a little over $220,000 available. So it's a fairly significant pot of money for respite services. But yeah, it'll really be dependent on terms of how people apply, and everything we do is based on a scoring system in our review committee. So certainly if you apply and aren't awarded or have questions about your award, please let us know. In the RFP, there's a list of how it's scored for the narrative and the budget, and how the review committee really looks at it. There are a few additional points usually given for specific rural counties, but other than that, it is very cut and dry. That's exactly what our review committee goes off of. So definitely recommend looking at that. But yeah, no exact amount or exact funding anticipated, but again, I think it'll be pretty competitive. Oh, and again, feel free to just send questions in as you think of them, and we'll just sort of share. Okay, so to kind of shift gears, we're going to give you some updates on some of our other programs. So one is our Respite Care Task Force project. For those of you who are not familiar with that, in 2015, the state appointed a Respite Care Task Force made up of stakeholders, professionals, and family caregivers from across Colorado and across the lifespan to really look at sort of what does Colorado need to do to prepare itself for supporting families through respite care and just keeping caregivers afloat, essentially, long-term in Colorado. And so the 4 recommendations that were ultimately funded by the state from that task force focused on some more research and data around kind of the economic benefit of respite, looking at policy changes that might be recommended in terms of access to respite care through Medicaid waivers, as well as some of the regulations for people providing short-term overnight center-based care, marketing and general outreach, as well as training for respite providers. So Biannual Coalition are the contractor with the Department of Human Services to implement those recommendations. It's about a 2.5-year project, so we're about 60-65% of the way through that. And we did submit a report at the end of June. It's currently being reviewed by CDHS, so kind of just hold tight. We'll let you know what we can share when we can share it. But do know that that's sort of where it is for right now. All right, and I am going to hand it over to Erica Smith from our staff.
Hello there. So one of the bigger projects that we can tell you a little bit about from the task force is the Caregiver Awareness Campaign. The desire to run this campaign really came from, we know that there are vast numbers of caregivers, family caregivers across Colorado, and we want them to be able to access resources family caregiver might find useful both in their caregiving and in their personal lives, and just kind of know that those resources are out there and are available across the state. So we have been working with a Colorado-based PR marketing firm here to develop a campaign from scratch. This campaign eventually will be spread out across the state, and the desire of the campaign is really twofold. It's to encourage family caregivers who maybe don't see themselves as a family caregiver, but see themselves as a spouse or a parent or a child, of somebody that has special health care needs, but really isn't accessing those resources because maybe, they're not searching resources for family caregivers in Google. And so then the second point of that campaign is that we want to help understand that you're a family caregiver and what that looks like, and then connect you up with resources in your area. And so I can give you a little peek at what that campaign is going to look like. These are all you'll see that they have Shutterstock and iStock over them because we're just finalizing this campaign creative right now. But the idea is, as you can see on there, the tagline is, your care may be super, but you're only human. And then what that will be doing is sending caregiving resources. We're finalizing that also right now. That will be a vanity URL, so basically a landing page that's connected to our website, ColoradoRespiteCoalition.com, and will connect caregivers to resources and different parts. And then it goes statewide, so that's going to be coming out in August. For partner agencies that are in those two areas specifically right now, we're developing toolkits that we're going to send out to you. So those will be posters, postcards, and different pieces that you can connect and share out to partners. Also, the county, it will be coming your way later this year. And then the other piece of update, as Megan mentioned, is that we have a whole lot of website updates underway. The first part of that is that we have changed the navigation of the site index, or we're about to change on our website. The hope is that this will make it far more user-friendly, far more easy to find resources. And then the other part is that we're creating a resource database on our website also. The focus is really going to be on having access to training and education for both family caregivers and professional caregivers, but also access to other resources. And so I can just give you a peek of what those are going to look like also. They'll be live later this month. Our website navigation is going to change. You'll see that along the top there'll be kind of fewer tabs to choose from and hopefully easier for you to find what you need. And then what currently is our respite locator is going to be incorporated into this resource database. So all in one database, you'll be able to find kind of educational articles and resources, events near you, resource agencies that can assist with all different kind of resources from, finances to advanced care planning, etc. And then you'll still have the provider locator in there also, so don't worry, that information is not disappearing. So you'll be able to search by those. The cool thing is that we have search filters, so you'll be able to specify by the type of care that you're looking for, the type of resource that you're looking for the age, for example, and then, hopefully we'll find you resources that you need to build it easier.
Yeah, and kind of along those lines, almost all of our website updates come from kind of hearing from you guys. So as we transition, let us know what's working well and what's not working. And also, please keep sharing your events or announcements or any resources you have. I think the beauty of this new database is it's going to be super user-friendly and easier to sort through things. So we're hoping to really add more content. So a lot of you are great about sending if you've got a new support group going on in your area, or like, hey, just so you know, we just added this new program. But if you're not in the habit of doing that, please feel free to send it out. It's essentially free marketing for you guys, which is great. And also, if you're on our locator, if you can just take a couple minutes and double check your information as we're kind of going through that process of transitioning everybody over. I know we occasionally get people that just have updates. And I totally understand it's really easy to forget you're on the system. We certainly have been there as well. But just take a couple minutes, make sure everything's up to date, and feel free to just send us an email and we can adjust it on our end if it's not.
Great. And another opportunity to, stay involved and really be connected with us here at the Colorado Respite Coalition on the statewide level is by joining a local and regional coalition. So these are groups that are really the boots on the ground, collections of local respite providers, partners, other agencies, and even family caregivers come together and really have the opportunity to network and share resources, discuss programs that are available, and also try to determine some solutions to respite service gaps that may that may be there. These local groups really take their information and report back to us at the statewide level so that really steers where our programming and directions really go towards. So there are regional coalitions popping up all over the state. We've got a few that we're really working to build and re-engage. The Northern Colorado Respite Coalition, they typically meet in Loveland and most often serve Larimer and Weld County. There's a meeting coming up on August 15th. You can visit our website at coloradorespitecoalition.org and go to the local efforts tab to get the specifics on that meeting, or join our mailing list and you'll get these updates all the time. We also have our Southern Regional Respite Coalition, which meets in Colorado Springs, and that group is meeting tomorrow morning, so you can continue this conversation immediately. No need to take a break. And that meeting will be, again, that information is all online. Our Denver Metro Regional Coalition operates here in the metro area, serving all the counties in and around Denver Metro. We're also having some really exciting efforts up in Summit County and out towards Mesa County. Our two really new areas that we're trying to engage folks in is down in Durango. We'll be doing a regional coalition meeting there on August 23rd. So if you have extensions of your office in any of these areas or partners that you think would be great to engage, please let me know. And then we are also doing a webinar regional meeting for a friend. I know they're really powerful places to get information on what's happening right around you and be able to have some support with your network. So if you have questions on regional coalitions, feel free to reach out to me, Allie Billman.
Alrighty. So I think we may be wrapping up. Sorry. Technical issues.